First off, Indiana Lyme Connect is a nonprofit with a mission to dramatically reduce tick-borne illnesses in Indiana. We do this in 3 ways. First, by connecting Hoosiers not only to information on Lyme disease, but also to research-based effective tick prevention strategies. Secondly, we connect Indiana healthcare professionals to accredited educational courses on Lyme disease and other tick-borne infections. And we also connect those suffering from Lyme disease to a compassionate support community. Indiana Lyme Connect, or known as ILC, is an all-volunteer nonprofit who depends on your donations. And these donations are tax deductible. Check out our website for the donation button and other ways to give. We are delighted to introduce our speaker, Dr. Kimberly Lentz. Dr. Lentz is an Indiana native. She graduated from Ball State University and Indiana University School of Medicine. Additionally, she completed the tick-borne infection physician training program through the International Lyme and Associated Diseases Society, and she remains active in that association. She began dealing with Lyme disease in 2004 when members of her own family became ill. And in 2010, she opened a new medical practice in Zionsville, which focuses on treating Lyme disease and other tick-borne infections. Today, her practice has grown and she has 3 full-time MDs serving those with tick-borne illnesses with a goal of restoring health through an integrative approach. I am really thrilled that Dr. Lentz is a board member for Indiana Lyme Connect, and she, along with her husband, are tireless advocates for health in Indiana. So I want you to sit back and enjoy her presentation on know the signs and symptoms of Lyme disease and what to do if you get a tick bite. Welcome, Dr. Lentz.
Thank you, Leanne. Leanne gave you the information about me. I did grow up in Indiana and have lived my whole life here. And as she said, we kind of learned about Lyme disease when my husband got sick and then one of my daughters, and found it very difficult to find any help and had to go to California to get help. And so because of that, when Dan recovered, we decided that it would be a good idea to open a practice. And initially it was just he and I. And then now, as she stated, I have 2 other full-time doctors in my practice taking care of people in Indiana who are suffering from tick-borne infections. So we're going to go through about 6 points, and I will try to get through all the slides. If I don't, there's some preventative things at the end that I will go through very quickly that you'll be able to view on the webinar, on the website, after the fact, if we don't get to those in detail. But the first thing to know is that there are ticks in Indiana. You may not be aware of that. You may be aware of that. And because of that, there's Lyme disease in Indiana. You may have had friends or family or physicians tell you that we don't have Lyme disease here, but that is not the case. Lyme disease is the most common vector-borne illness in the United States. The CDC just recently increased their estimation of how many cases there are annually up to 476,000 cases. And it's more likely higher than that. That's based off a lot of testing and not as much clinical diagnosis. And so more than likely there are more cases of that every year. These next 2 maps are their veterinary maps. So one of the advantages is that veterinarians regularly check pets, particularly dogs and sometimes horses, for Lyme disease. So it's a routine screening that they do. And because of that, they're able to accumulate a lot more data that is projected out. So these are not statistics, it's just forecasting. It was a forecast of the prevalence of Lyme disease. So that's just, if you're in this area, like you can see parts of Indiana there that are in red, 10 to 100% of that area is going to have Lyme disease. And so the veterinary maps are very helpful in that regard, and they're updated annually. And it's just a little bit, gives you a better idea of what's going on. This one is just another example. This one is for another infection you can get from a tick called Ehrlichia. As you can see, it's much more prevalent in southern Indiana, and we'll get into that a little bit more as to why that is. But again, you can see that there are tick-borne infections all over the state of Indiana. These are just two examples. We are going to talk a little bit more detail about the Lone Star tick. This is a tick that used to be just south of Indiana, but now, as you can see from this map, it is much more widespread up in covering all the state of Indiana. I think that our experience in our practice is that it seems like when people have seen ticks that it's still like a South 40 thing. So it seems like if you're south of I-70, you're more likely to encounter a Lone Star tick. If you're north of I-70, it's more of the deer tick. So what do you do if you get bit by a tick? Well, the first thing is you don't panic. And you need to know how to properly remove a tick. You don't burn it off. You don't squeeze it off. You don't crush it off. Because it's important, because the bacteria from a tick are in its mouth. And so you want to get the tick off in a proper way. So it's better to use pointed tweezers instead of flat tweezers because you're less likely to squish the tick. And then you just use the tweezers as close to the skin surface as you can, and you gently pull up. If it seems like it's not coming, just keep applying the pressure, because eventually it's going to let go if you give it enough tension. Once you remove the tick, you want to clean the area with soap and water or alcohol. Again, you don't want to crush it, or you don't want to burn it off. I don't know what you did when I was a kid. We burned them off our pets. So you don't want to do that. And I would suggest that you keep the tick. So some people panic and they pull the tick off and they flush it down the toilet. So I would suggest that you put it in a baggie with a wet cotton ball, because you can actually test the tick for different organisms and see what is present in the tick. It may not be necessary, but if you keep the tick and things start to happen, you will have it available to be tested. I put some places there on the bottom of the screen where you can send the tick to get tested. Also, I would strongly encourage you to, and I'll say this in my next slide, view Dr. Mather's webinar from 2 weeks ago, because he gave a fantastic presentation on how to identify a tick and how you can be fooled by a tick, because if a tick is engorged, it might not look like it does in some pictures. And then you kind of know what you're dealing with, as we'll go into in the next slides. So identifying it is one way to figure out if you are at risk. So if you go to Dr. Mather's webinar, he talks about identifying it and being sure that you know what the tick is. He also has the capability of you sending him a picture of your tick, and he will tell you what the tick is, and they can even estimate how long the tick was attached at the time that you pulled it off. So the most common tick that we see is, and the most concerning tick, is a deer tick. So deer ticks are pretty much everywhere now. They used to just be thought to be in the Northeast, but they are spreading. Deer tick carry Borrelia, which is what causes Lyme disease. They also carry Babesia and Bartonella and Anaplasma and Ehrlichia. And these are all things that we call co-infections. So they are other bacteria or parasites that live inside a deer tick that you could possibly get an infection of that organism if you were bitten by a tick. The thing about this photo that you need to realize is that how small the larval tick is. The larval tick and the nymph tick are the most infective tick as far as transmitting an organism. And they are also the most very difficult to see because they're so tiny. And there'll be another picture later to do a comparison. The other tick that I previously mentioned is the Lone Star tick. Again, these used to be a little bit south and west of Indiana. They've moved north. And the most distinguishing feature of a Lone Star tick is the white dot on the back. So sometimes that's pretty easy to identify. In an adult, it's a little harder to identify in a larval tick. They carry an organism called Borrelia lone stari. It's thought to be a Lyme-like illness, but it's been not clearly defined. But they also carry Ehrlichia, tularemia, and Rocky Mountain spotted fever. The third tick that I'm going to cover tonight is the American dog tick, because if you have pets, you've seen these. These are the great, big, huge gray ticks that you pull off of your dog when they come in from being outside. Usually if it's that big, it's been attached for some time. These ticks aren't traditionally thought to carry Lyme disease, but they do carry Rocky Mountain spotted fever, tularemia, and tick paralysis. So they are important. But at this point, we don't think it's actually causing technically Lyme disease, but you could get other infections from a dog tick. This picture is really nice because it gives you a perspective with this paper clip. So the large tick on the left is an American dog tick. The dark red and black tick on the top inside the clip is an adult female deer tick. The next size one down is the male, and then you can see how very small the deer tick nymphs are. And that makes it extremely hard to identify them and find them on your body at times. If they're in your hair or on the back of your leg or around your ankles or in your groin area, these could very easily attach and you would not really be able to see them because they're so small. So if you've been bitten by a tick and you've taken it off successfully, you think you know what kind of tick it is, then what do you look for? Not every single tick has Lyme disease in it. Not every single tick has some sort of infection that it's going to give you, but it does have that possibility. So when you know what tick you have, you kind of know what you're dealing with. So the hallmark of Lyme disease is a bullseye rash. And your doctors are well aware of this. It's what we learned in medical school years ago. The misconception about a bullseye rash is the CDC will say that 70% of people have a bullseye rash. My clinical experience is that it's much less than that. Maybe 30% remember a bullseye rash. Now, they may have had a bullseye rash, but they may not have seen the bullseye rash. Because again, if you have the bite in your hair, or if the bite is on your backside, or if it's, someplace where you can't see it, you could have had a bullseye rash and not known it. So I'm going to scroll through some pictures here to kind of show you that it doesn't always look exactly like a bullseye. And these are all photos of documented Lyme disease cases and how different the rash can look. So sometimes you have to really back rash to see the bullseye. Like in this case, you see the red part in the middle. If you're not close, you could forget about the stuff, the peripheral ring of the bullseye. This one's not quite so clear, but you can see they have three. And then the one off to the left is probably another bullseye, but it obviously looks a little bit different than the three on the right. This one doesn't look like a bullseye at all, but this is a person who did have Lyme disease from this bite site. Again, here's one that looks more red. I don't know if on this picture, if you zoomed out, would he have a ring out farther that would be more indicative of a bullseye, but regardless, it is a Lyme disease rash. And these just give you an example. So if you have a rash, then that is of concern. Some people will have a little rash at a bite site just as almost like an allergic reaction to the bite. But if you start to have something more substantial, then that is of concern that you could have Lyme disease or another tick-borne infection. The other things to look out for to see if, did I get something from this tick bite, is if you felt ill a few days or weeks after you had a bite. That may indicate that you picked up an infection. If you were told you have a summertime flu, or you thought you had a summertime flu, we don't get influenza in the summer. And so if you have all the symptoms of influenza, but it's summer, then that may be indicative of a tick-borne infection. Also, if you suddenly develop new symptoms that you never had before, and they don't go away after a short time. So if odd things start happening and things you've never had before, then that may be a tip-off that you could have acquired an infection from the tick bite. the thing to remember is symptoms, and I'm going to go through in a little more detail, but symptoms of Lyme disease can affect any part of your body. So as a medical doctor, I was taught that everybody with Lyme disease knows that they got bit. They all have a bullseye rash, and they all have a red swollen knee joint. And that's what we were taught. And that is not the case. So not everybody knows they've been bit, but you should know if you've been to a place where you could have gotten bit and started to develop symptoms. So that's important. Not everybody gets a bullseye rash, and not everybody has a red swollen knee joint. You can have a wide variety of symptoms, and some of them are as follows. And it looks like a crazy list, and it is a crazy list. You can have a fever. As I stated, you can have a rash. You can develop Bell's palsy, which is like a drooping on the side of your face. That's actually relatively common in Lyme disease. You can have pain in any joint, not just your knees, neck included. You can have muscle pain and headaches. You can have fatigue. You can have heart racing. Some people develop numbness and tingling. Your vision can get disturbed, whether it's blurry vision or double vision or just not being able to focus. Some people have trouble with balance and start having tremors and muscle twitching. You can have chills. Your glands can get swollen. Some people can have shortness of breath and feel like they can't get their air. You can have night sweats. And then some people will even experience mood problems. They may get more anxious all of a sudden, or they may get more depressed all of a sudden. And so if any of these symptoms are new for you, and you've either known you've gotten bit by a tick, or you've been to an area where you could have gotten bit by a tick and these develop, then you should be going to your doctor. And that'll be the next slide. I did want to point out, though, Rocky Mountain spotted fever. So I'm not going to talk about the other infections specifically, but I want to mention Rocky Mountain spotted fever, mainly because Rocky Mountain spotted fever is the one tick-borne infection that you can actually die of acutely. And so I think it's important for you to kind of know what it looks like, because if this were to develop, you would need to go to the emergency room right away. So it usually starts out with, a few days after a bite, you'll get fever, chills, really bad headaches, muscle and joint aches. And then usually a couple of days after those symptoms start, you'll get this very distinct rash. And the photo here is a pretty good example of that. And really the hallmark of it too is that this rash will often be on the palms of your hands and the sole of your feet. So lots of rashes that we get do not affect our palms and soles. And so that's one of the hallmarks of Rocky Mountain spotted fever, that it will affect those areas. And so if you see a rash like this, you should just go get it taken care of, because Rocky Mountain spotted fever, like I said, it can kill you quickly. A lot of people think that maybe that's not in Indiana, but it is. I've started testing for it more often. I often find positive testing. The people that I'm testing are not acutely ill, however, but there was, if any of you are from Indiana, in central Indiana, about 3 or 4 years ago, there was a little girl who died of Rocky Mountain spotted fever. And so it kind of heightened everybody's awareness that Rocky Mountain spotted fever is here. And if people have these kind of symptoms, that you should seek medical care right away. So what do you do if you have symptoms? So you've been out hiking, you've been playing in the woods, you went mushroom hunting. You either know you got a bite, or you started to feel sick a few days after you got a bite, or after you did these activities. What do you do then? So you should call your doctor. You should let them know that you got bit, or you should let them know that you've been someplace where you have been exposed and you could have gotten bitten. If you're having symptoms, you need to be persistent to get treatment. Your doctor will more than likely want to run a test, but you can't rely on testing. If you present to the doctor within 2 weeks of a bite, your test is probably not going to be positive. It takes your body a couple of weeks to mount an antibody response to the level that it would be positive on a test. So you have to know that a test in the acute setting sometimes will miss a Lyme disease. Even best case scenario, the test that the two-tier screening that most doctors do is only about 40% accurate. They've done about 12 different studies on two-tier testing, and about 40% of the time it's accurate, which for a screening test, that's really not a very good percentage. It should be much higher than that. So you just got to keep that in mind. So if you go in, you know you've gotten bit, you're having symptoms, and they say, you don't have Lyme disease, your test is negative, you need to go see somebody else probably. You don't have to have a bullseye rash. Sometimes your doctor will say, well, you don't have a bullseye rash, so you don't have Lyme disease, but you still could have Lyme disease without the rash. And if you do have the rash, you should know that that is diagnostic. You don't need a blood test. If you have had a tick bite and you have a bullseye rash, you have Lyme disease, and you should seek out treatment. Unfortunately, what happens is there's some resistance because a doctor may tell you, we don't have Lyme disease in Indiana. Or they may say, you didn't have a bullseye rash, so I don't think you have Lyme disease. And so if that's the case and you are suspicious of having a tick-borne infection, you need to be your own advocate. And if you don't get help with your doctor, you need to go see another one who will help you. It's getting better in Indiana. Primary care doctors are more aware of the fact that there are ticks here and there's Lyme disease here and people are getting sick. And so you do have to advocate for yourself. If you do get symptoms after you have treatment, then you need to either follow up with your doctor or consider seeing another doctor, particularly one who is aware of Lyme disease, because sometimes short-term treatment is not enough. And acute treatment and resolution of all of your symptoms is the key to preventing a long-term illness, because if you don't get rid of it in that short time, then you don't want to become chronically ill from the infection. So things to remember in that regard is the standard treatment length after a known tick bite with suspected Lyme disease may not be enough. So some doctors will give you 3 days of antibiotics. Some doctors will give you 10 days of antibiotics, but you need at least 28 days of antibiotics. You may need more than that, but at a minimum, you need that. And so sometimes getting the doctor to go that longer length of time can be a little bit difficult. One other thing that I've seen happen in patients is they got bit, they got sick, their doctor said, yes, I think you have Lyme disease. They put them on an antibiotic, and then 3 or 4 days later, they just felt so much worse. And their doctor goes, you must not tolerate the antibiotic. Stop the antibiotic, and you don't need anything else. So you need to just remember that sometimes you do feel worse when you first start a treatment for Lyme disease, and you should complete the course of antibiotics. Now, obviously, if you're having an allergic reaction, with a rash and itching and shortness of breath, you should stop it and you need a different antibiotic. But if it's just that you generally feel worse with the treatment, you should really try to complete that course of antibiotics. You need to remember that tests aren't reliable. If you have had or could have had a bite and you have symptoms, you can't depend on a test to diagnose Lyme disease. It is technically a clinical diagnosis. The testing is often negative and you should be treated even if your test is negative if your symptoms are consistent with Lyme disease. If you cannot find help with your doctor, you should seek care elsewhere. And if you are wanting to seek someone else, then 2 organizations, one is LymeDiseaseAssociation.org and the ILADS organization, ilads.org. They have search engines to help you find a provider in your area. And so a lot of times you would enter in your zip code and then they will give you a list of providers in your area who are registered with them as doctors who are aware of Lyme disease and treat from a different approach. Okay, that's what ticks look like, what they carry, what to look for, what you need to do after you get bit. But really, I put this later in the presentation, but it could have been the first thing in the presentation is you need to avoid ticks. I don't like to hear my patients say, I'm never going outside again. That is disheartening to me because obviously people who get Lyme disease are usually people who like to be outside. And that's how they got bit. So that really makes me sad when patients say that because there are a lot of things that you can do to avoid getting bit by a tick. So the first one is in general, and I've got the general list here, but just go to the photos because these are a pictorial sometimes more helpful, is you can treat your clothes. And you can find all this information on the ILC website. This all came from ILC, but they're very helpful. You can treat your clothes with Permethrin. You can do it yourself, or you can buy clothes already treated, or you can send your clothes away to Insect Shield and they'll treat them for you. But even if you just treat your shoes and socks, you have 74% times more protection from a tick latching on. And so, as you can see, shoes and pants are the most important part of our clothing. This is just a little thing. So if it's a do-it-yourself treatment with Permethrin, that's the most inexpensive way to do it. And it will last for 6 washings. And then you would need to treat those items again. If you mail it to Insect Shield, they will treat the clothing for you. And it will last for 70 washings. It does cost more money, but it lasts for a longer period of time. And then you can go to websites that primarily cater to people who hike and spend a lot of time outdoors. You can find pre-treated clothing as well that will last for a long time. There's also something called rhino skin, which it's not Permethrin impregnated, but it looks kind of like Under Armour and it feels kind of like Under Armour, but it's a material that ticks can't bite through. And so hunters, for example, will use that because they don't want it to smell because they're trying to not scare off the deer that they may be hunting. Then you would apply a skin repellent to any area of your body that's not covered in clothes and is exposed. So you can see there at the top the ones that you should consider. A lot of people don't like to use DEET because it may be toxic, but it is effective. And so I've told my patients before that if you use DEET, that's fine. Just when you come in, you should wash it off right away. Picaridin has been my one of choice lately because it's not toxic and you can put it on your skin and you don't have to worry about washing it off immediately. The other two I'm not as familiar with, but they can all be purchased online, but you do need to cover the areas of your skin that are not covered by clothing. People love the natural products, but there is no proof that they work. They might work, but you may not want to go with might work. You probably want something that will work. And so until those products are more thoroughly tested against black-legged ticks and Lone Star ticks, I don't think I would advise you using them. They probably work better for mosquitoes because mosquitoes usually don't need quite the intense repellent as ticks do. When you come back in from outside, you can put your clothes in the dryer, and that will help to kill and knock off any ticks that are on your clothes. You should do a tick check, especially of your children, because they won't pay attention. You need to look in their hairline and under their hair and in places where they can't see, and particularly down around their legs and ankles. One thing that I advise parents to do with their kids is maybe you take a set or two of clothing that you treat with Permethrin yourself, and you tell your kids, these are your outside play clothes, and when they go out, they put them on, and when they come in, they take them off. And then that keeps them, then they get into a habit of, this is what I need to do when I go outside. And then you don't have to treat every piece of clothing that they have, but you can just treat their outdoor clothing. And then most people advise that you take a shower pretty quickly if you've been out in an area where you could have been exposed to a tick. Then, of course, you can create a tick-safe environment. So this is just depends on where you live. If you've got a lot of woods, if you've got a lot of brush, things like that. And these are just tips of things that you can do to try to keep ticks out of your yard. I'm not going to get into a lot of detail about the pets because that's going to happen next week. And I will say that I have a lot of people who say, well, I don't go in the woods or I don't go out in the grass and I'm not outside. And then I'm like, do you have a dog? Yes. Do they come in the house? Yes. Do they sleep with you? Yes. Then they are at risk to have a tick too, because the dog could carry it in, they could attach on you in the bed or playing on the couch. And so even though you may not be outdoorsy person, your cats and dogs who do come in and out of the house could carry a tick into you as well. And we'll let next week's lecture get into a lot of specifics in that. This is just information about Indiana Lyme Connect. If you want more information, I encourage you to go to the website. And again, I would also encourage you to go back and look at 2 weeks ago now, Dr. Mather's lecture on identifying ticks. It was very helpful. I thought it was useful to me even. So I would encourage you to do that. So if you need more information, Indiana Lyme Connect, LymeDiseaseAssociation.org, LymeDisease.org, ILADS.org. And then our office website is New Horizons Integrated Medicine, or NHIM.us. We don't have as extensive of a website as the other organizations, but Dan does have a really good section of archived scientific articles on various different aspects of Lyme disease. And so some people who are looking for a literature reference can find good information there. And I'm done. So I'm going to have Leanne see if there are any questions that I can address, and I will do that.
Right. Thank you so much, Dr. Lentz. Really appreciate it. It was great information, important information. So I am going to be, if you have any questions, please, again, refer to the Q&A at the bottom of your screen, type in those questions, and I will address them with Dr. Lentz. So the first one coming in was a concern about permethrin. When you mentioned that for the clothing, it says, isn't permethrin toxic to humans? Could you address that for us?
No, it's not toxic to humans. The only toxicity that I'm aware of with permethrin is that some lawn care. So if you get your lawn treated, you can get your lawn treated for ticks, and I believe they use permethrin. And what I remember them telling me is that it actually is toxic to cats, not dogs or people, and that you would just need to keep your cats inside until the permethrin dries on the yard. But permethrin is not toxic to humans that I'm aware of.
Okay, thank you. Another question is, would treating a hat with permethrin keep or help prevent ticks from latching in the hair?
Yes, that would be. I actually wear a hat all the time. So if you see me in my office or here, I don't have a hat on, but 95% of the time I do. So how permethrin works on the clothing is permethrin is a neurotoxin to the ticks. And so when they land on your clothes or your hat, they will crawl for a very few seconds and then they will be paralyzed and they will fall off. And so, yes, if you wear a hat, and I would suggest you do it, especially for your kids, especially if you're going to be out in the woods where ticks could fall from above, it would be very helpful to treat your hat.
Okay, perfect. Okay, another question that came in is, let's see. I found someone who found a Lone Star tick on themselves last July. They did send it in for a full analysis and it tested positive for Lichia. And they went on doxycycline for 10 days. And they're just basically asking, based on what you were talking about, length of time, was that long enough? So again, do you feel like from a medical perspective, that is long enough treatment?
So there are people out there who have been bitten by ticks and they get a traditional 10-day course of an antibiotic and they do fine. If you got bit and your tick was, and you had symptoms and the tick tested positive, I would say you should treat until your symptoms go away. So if it was an acute bite like that, you have a much better chance of getting rid of the infection with a shorter course of antibiotics the quicker you get them. So the longer somebody goes from the time of the bite until treatment, the harder it is to get rid of it. Now, Ehrlichia is a little bit different than Lyme disease because 10 days for Ehrlichia actually may be enough because Ehrlichia grows faster. So Borrelia or Lyme disease and Bartonella grow slowly. And so all antibiotics work by impairing the bacteria's ability to replicate. And so if you've got one of those slow growing bacteria like Lyme disease, it takes longer treatment because the bacteria doesn't grow as fast. When you have a faster growing bacteria like Ehrlichia, 10 days might be enough. Just like strep throat. So strep throat grows extremely rapidly. You can double the amount of strep in your throat in 48 hours. So when you get antibiotics for strep throat, 7 or 10 days is plenty because in that time frame, you're going to kill all the replicating bacteria. So in that particular scenario with specifically Ehrlichia, 10 days might be enough. I would say if you're still having symptoms after 10 days, it might not be enough.
Yeah, that sounds wise advice. Another person may have come on a little bit later. They were asking, how do you remove an embedded tick? Could you review that real quick for them?
Yeah, so you want to get a pointy pair of tweezers, not a flathead pair of tweezers. You want to grab the tick as close to the skin surface as you can and gently pull straight out. Don't twist it out, crush it out, jerk it out. Just gently pull it because you would like to get the whole head out because the bacteria are in the mouth of the tick. And so you want to get the whole thing out. Sometimes you can't, and you got to go to the emergency room. Or if you don't get it all out, you may need to go to the doctor that day or the next day and have them remove the rest of it. But that's generally how you do it. Usually the tick will give in. If you apply gentle pressure upward for long enough, it will eventually let go and you'll be able to pull it off.
Okay, great. And we do have some of that, some videos and such on our website that they could look at as well. Another question came in talking about is Lyme disease reportable in Indiana? And you know, that question of how many cases a year do we have in our state?
So it is reportable. So if you, for example, if I run a test on you at my office and it comes back positive for Lyme disease, the lab will call the health department in your county and notify them that there was a positive Lyme disease test. What will sometimes happen, probably not happening now because of COVID, because the health department has other things to do, they would call you. They would say, we hear you have a positive Lyme test. Where were you when you got bit? How long ago was it when you got bit? Did you have a bullseye rash? Do you have a swollen knee? Have you gotten treated? And the nurse just has a checklist of things that they're supposed to ask. And then they sort of decide if they think you really have Lyme disease or not. So if you tell them, which unfortunately a lot of my patients would say, I don't know when I got bit. I don't know where I was when I got bit. I never had a bullseye rash and my knee is not swollen. Unfortunately, that may not get reported because if the nurse decides that you didn't meet the criteria that you really have Lyme disease, it wouldn't get recorded, even though you may have other symptoms of Lyme disease and you may have had a bite. And so it's a little bit of a problem. So normally they're not going to record. And then the other issue with the recording of it is they tend to go by CDC guidelines. So the CDC has a very set criteria that they use to say somebody has Lyme disease. And some of us don't agree with that criteria. So we would make a diagnosis based off clinical picture and testing. And so sometimes we think you have Lyme disease, but the CDC doesn't agree.
And that is one of the reasons for acute infections not being caught correctly, and they go to a chronic state. Is that right?
Right. So what will happen sometimes is people will have, they may have a lot of weird symptoms or odd symptoms, as you saw on that list, and they go to their doctor and they say, I've got all these symptoms, and oh, by the way, I got bit by a tick. The doctor would do the test. If the test was negative, they would go, oh, well, maybe you've got rheumatoid arthritis or multiple sclerosis, or maybe you have something else, but you don't have Lyme disease because your test was negative. And unfortunately, that happens. And so then people get missed, and then they may go months with dealing with all these symptoms with no idea what's going on. And then they end up with a more chronic infection because it didn't get addressed early on.
Wonderful. Another interesting question is, can Lyme disease be latent and appear months or years after the infection? And with that comes also, is Lyme disease curable?
So I would say yes to the first one, but it's hard to know for sure. So there are people who get Lyme disease who don't get sick. Okay, so I've had people in my office who, usually family members. So when one family member gets sick and they find out they have Lyme disease, then other family members will get tested. And sometimes other family members are positive, but they've never been sick and they don't ever get sick. And so it just shows me that some people can get bit and their immune system is wired properly and it will get rid of the infection. For some people, that doesn't happen and it doesn't get rid of it right away, and then they get into a chronic state. So then the thing about the latency is I've had lots of patients who they remember bites from the past, and they remember having lots of bites maybe in the past, but they were not sick ever. And then they have a series of stressful events happen. And sometimes, a relatively short period of time, maybe within several months. They may have a car wreck, or mom dies, or I lose my job, or I have to move, or I have 2 babies or 3 babies, I have all these pregnancies. And then their immune system gets taxed a little bit and stressed. And then this old infection sort of comes to the surface. It's hard to prove that because you could make an argument, well, maybe they just got bit again. Maybe they did. And I can't prove it one way or the other, but I've just seen enough clinical pictures of people who had histories of lots of tick bites, but were never sick until all the stress came on. And then when they suffered from the stress, the immune system couldn't handle it anymore. So that's my thought process on, could it be latent? Can you cure it? I think you can cure it. You will go on, if you ever do get onto a Lyme support group site, there will be people who tell you can't cure it. But I think that you can cure it. You can definitely cure it if you catch it early. So, which is the key to all of it, is early identification and early treatment, and your likelihood of totally eradicating it increases astronomically. If you've got somebody who's been sick for a while and they're in a more chronic state, it may require longer treatment. But I think that you can still cure it. It might take longer. It might take different treatments. It might take a combination of treatments, but I think that they can get cured. I only have a handful of people who I think don't get cured, but I think for the most part, people can. I think the hard part of knowing cure or not is sometimes through the process of an illness, you have damage to your body. And so, for example, if you have joint pain with Lyme disease, it's possible the joints could be damaged during the infection. You could get rid of the infection, but you may have some residual joint pain because of what you've been through in the illness. So sometimes it's hard to delineate those two, but you can have some residual effects. It doesn't mean you're still infected necessarily.
Yes. Well, thank you for that. Another question is just about the tick bite itself. So a couple of points to it, but one of the question is, how long can a tick stay attached?
How long can it? Days and days if you don't pull it off. So that has changed over the years. So the CDC used to always say it has to be attached, 36 hours or 48 hours and then 24 hours. It probably needs to be attached at least a few hours because it's got to attach. It's got to regurgitate. This sounds gross, but it's got to regurgitate the stuff up into its mouth parts and spit it into your body. So there's a little bit of timing with that, but there is some animal documentation that the tick could transmit something in just a couple of hours, which goes against sort of what the CDC says. They usually say 24 hours, but if it has been on there long enough to get attached and start to take a blood meal, you could, which happens within a few hours, you could definitely have picked up an infection.
Okay. And it was saying how sometimes people don't recognize that they've had a tick bite. So the question is kind of, how do you know you've had one? Can a tick come off all by itself?
Yeah, it can fall off by itself for sure. I mean, for example, you could go out, you could have a bite, or let's say the dog comes in and brings a tick in and you guys are laying on the couch together, the tick hops over on you, it attaches, you don't really notice it, you go to bed that night, tomorrow morning you take a shower and you shower it off. And so it could have been on, or same thing if you've been outside, you could come in from outside, you didn't know it was there, especially if it's like in your hair, you go to wash your hair, suds it all up, you dislodge the tick, it falls out and you never know it was attached. So they will come off, they don't stay there forever, but they can get large. It's really impressive if you look at Dr. Mather's slides, because he has some really engorged ticks that he had pictures of. So if anybody's interested, they'll learn a lot from that presentation.
Okay, wonderful. Another tick is about the alpha-gal syndrome, which can come from tick bites. And wondering if the tick reports show, are they being diagnosed with that as well? Are they looking for that infection?
That's not an infection. So no, if you send your tick in, there will be nothing about that because alpha-gal is not an infection. So for those of you who don't know, and it's with a Lone Star tick. So probably 5 or 6 years ago, what was starting to happen is there were certain individuals who had gotten bit by a Lone Star tick, and they all of a sudden became allergic to red meat, and they couldn't eat red meat. And so I remember hearing one of these cases probably right after I opened my practice. And it was the craziest story ever. A guy was telling me about how awful he felt after he ate a hamburger and blah, blah, blah. And I said, well, I don't know if you have Lyme disease or not. I don't know what's going on. I said, but why don't you just quit eating hamburgers? And he goes, I love hamburgers. I can't quit eating hamburgers. And so that was really before we knew what alpha-gal was. And then a couple years later than that, I saw my first article on that people were developing antibodies to red meat after a Lone Star tick bite. Those people don't necessarily test positive for Lyme disease or anything else. Alpha-gal is a reaction to the tick spit. So there's a cross antibody when you react to the spit that then starts to attack meat. And so whenever you ingest, usually just red meat, it doesn't seem like it happens with like poultry and fish, but particularly red meat and sometimes pork, you will get ill when you eat that meat. And so it is not in the tick report because there's nothing for them to test in that regard. Now, it's so new that it's possible things will develop over time, and maybe we will identify it with a certain bacteria. Of all the patients I have who have alpha-gal, they have Lyme disease too. But my understanding is that there's a certain number of people who develop alpha-gal that actually aren't sick in any other way. So they don't necessarily have the other symptoms of Lyme disease. They just have this issue with eating red meat.
And another follow-up with that, someone else asked, have you ever seen patients that have the meat allergy and that they recover from it? That they no longer are allergic to red meat?
I haven't yet. So I have patients who can dabble in it after they're better. I have been looking into ways to try to see if there are any alternative ways to get rid of that allergy. There are some alternative medicine practices that I've been trying to get some of the providers who do that to see if they have any success at getting rid of it. I haven't had any of my patients yet who have alpha-gal follow up with those providers. So I'll give them names of people who I think might be able to take care of it, but as far as I know, none of them have done it. I've seen people become a little more tolerant of red meat, but still not able to eat a significant amount of red meat, like they wouldn't be able to eat a steak. So a lot of them, a couple of them can eat it and not get as sick as they did initially, where they'll be able to do a little better. And depending on how much you like red meat, you might tolerate not feeling great for a few days to have a steak, but at least you're not having, severe symptoms any longer. So, but like I said, I've had most of my patients with alpha-gal. It seems to get a little better, but I haven't seen total resolution of the issue with meat.
Okay. All right. We have a few questions talking about when the acute infection is not caught and it becomes chronic. So basically, can you discuss some of the long-term symptoms of Lyme if it's not caught and treated early? And what some of those symptoms look like, neurological, cognitive?
So basically that list I gave you at the beginning. So it's not really any different other than people who have chronic infection, I usually don't see them having fevers. You can still have fevers, and some of my patients do, but it's a very small percentage of people who have fevers out of the acute setting. But any of those symptoms on that list, and like I said, almost any symptom you can imagine. And then obviously some of those symptoms could be taken further, like for example, palpitations, heart racing. Some people may have heart racing and then they may start to have chest pain, or, they may, if they've got joint pains, they may have joint pains in other areas. I would say one of the hallmarks of Lyme disease that sets it apart from other things is I tell patients, no matter what the symptom is, if it's migratory and intermittent, it's probably Lyme disease. So if it's moving around your body, and if it comes and goes and moves around, then that is sort of a hallmark for Lyme disease symptoms, as opposed to if people have rheumatoid arthritis, for example, and they develop it in their wrist, they will always have pain in their wrist. They may never have pain in their hip, but it'll always be in the wrist. Lyme disease, your wrist might hurt today, it'll hurt for 2 weeks, it'll get better, and next week your knee hurts, and then it'll hurt for a while and it'll get better, and then the next week your ankle hurts. And so that's sort of the hallmark that I look at. So it's really the same list of acute symptoms that just don't go away or morph into more complex symptoms.
Do you see more severe cognitive and neurological impairment ever with your patients?
I see that a lot. It's not in everybody. So I think the other thing that makes Lyme disease difficult for your primary care doctor and maybe some specialists is that no two patients look exactly alike. And so I can have one patient who is all musculoskeletal. Their muscles hurt, their joints hurt, they ache, they're tired, they have headaches, and they're all sort of musculoskeletal. And then I can have another person who has no joint pain or muscle pain, but they have muscle twitching and jerking and seizure-like activity and light sensitivity. And they got all these neurologic symptoms, but they don't have any musculoskeletal symptoms. And then I have some unfortunate patients who have both. So they'll have a lot of musculoskeletal complaints and they'll have a lot of neurologic complaints. I would say that fatigue is by far the most common symptom, and it goes across the board. Almost everybody has fatigue. I have 1 or 2% of people who aren't tired. And in regard to the cognitive, I would say that's the second biggest complaint is most of my patients describe it as a brain fog. They just feel like they're foggy. I don't know if that is, I don't think it's necessarily a specific symptom for a certain infection. I just think that when you're dealing with a chronic infection, the burden of the infection, the toxins that the infection creates, some people's inability to get rid of toxins causes this brain foggy state. And it can be just as bad as severe fatigue or worse.
So if somebody suspects they're in a chronic state, do you say that there can still be hope in treating?
There's always hope in treating. Nothing will get better if you don't try. So, if somebody says, well, I've had Lyme disease and I probably have Lyme disease, but I've been sick 10 years, it doesn't do any good to go see anybody, I wouldn't agree. I don't ever promise my patients that they're going to get 100% better, because there's no way I can do that, honestly. But I will say that almost all of our patients get better. They may not be 100%, but if we can get them 75 or 80 and functional and able to work, I feel like that's a win. And so everybody's different on how they respond, and not the same. This one therapy doesn't work for everybody, but I think there's always hope that you can get better. I don't give up very easily.
That's what I hear. Good. That's the advantage of being at a clinic that understands tick-borne infections. So another question was, what is the biggest difference you see in identifying Lyme disease compared to MS in that interaction?
So there's a lot of my patients will have been told that they think that their doctors think they have MS, and they will go through brain scans and spinal taps, and a lot of times the spinal tap will be normal. So then they'll say, well, you look like you got MS, but your spinal tap doesn't indicate that you have MS. And so they kind of get mislabeled a little bit. On a brain scan, particularly an MRI, you will see similarities. So not all Lyme patients will have this, but patients with multiple sclerosis and some patients with Lyme disease have what they call periventricular white matter lesions. And so it's a common finding in both subsets of patients. Now, not every Lyme patient gets a brain MRI, so it's hard to know for sure if all Lyme patients would have it, because I don't get an MRI of everybody. But what I think happens is, so multiple sclerosis is thought to be an autoimmune process where your body is attacking parts of your brain, and it's giving you these lesions, and it's making you have neurologic symptoms. Just like rheumatoid arthritis is an autoimmune condition where your body attacks your joints and damages the joints. So my thought is I guess I'm not content to believe that autoimmune conditions just happen. That's what most doctors say. Well, it just happens to some people, or you're genetically predisposed to it. I feel like those autoimmune conditions, in a lot of cases, have a trigger, and usually some sort of infection trigger. It may not be Lyme disease. It may be a viral infection, or it could be another bacteria, or it could be Lyme disease. And when you get the infection and when your body starts to fight it off and it creates antibodies, those antibodies cross-react with your tissues and attack it like an autoimmune disease. And it can look like MS, or it can look like rheumatoid arthritis, but when you do all the tests for those things, they're negative. And so we've had a lot of cases in our office where somebody will come in and says, well, they told me MS. And we test them, it looks like they have Lyme disease, they get treated, and their MS symptoms go away. And so that doesn't always happen, but it does happen often enough that the whole autoimmune thing in Lyme disease, Lyme is definitely causing some sort of abnormal immune reaction that causes some people to look like they have another disease.
Well, thank you so much. We are out of our allotted time for questions, so we're going to close the question and answer. You are welcome to contact our organization. We have our email that you can go to through our website. Dr. Lentz, thank you so much for your time and expertise. was really helpful, and just comments and recognizing that we really thank you for your time. It's important information, and we're trying to prevent those chronic infections. So thank you so much. Appreciate it.
Thanks for having me.
Yeah.